I often find myself in an interesting discussion with patients about adjuvant versus neoadjuvant chemotherapy. Now, my medical oncologist colleague, Dr. David Margolith, has discussed on our Breast Cancer Answers website the difference between adjuvant and neoadjuvant chemotherapy. Quite briefly, adjuvant chemotherapy is given after surgery. It's an adjunct to the surgery and as part of the systemic treatment, the whole body treatment of breast cancer. The term neoadjuvant chemotherapy means upfront chemotherapy. And I'm often asked the question, well, Dr. Harness, is one of these better than the other? And the answer is no. It isn't a question of it being better than the other. We would never make, or certainly I would never, my colleagues ever make a recommendation where something is less than. Now, from my perspective as a full-time breast surgeon, neoadjuvant chemotherapy is really helpful in a variety of circumstances. Let me give you several examples. Number one, a patient presents with a really large breast cancer. Even doing a mastectomy would not be possible. These are typically what we call locally advanced breast cancers. So we go ahead and do the chemotherapy, the neoadjuvant chemotherapy, as a way of reducing down the size of the cancer so that we can eventually operate, including if we have to do a mastectomy. Another advantage is we've got a cancer that's sort of borderline as far as the patient being eligible for breast conservation or not. Patients highly motivated for breast conservation. We know that the neoadjuvant chemotherapy is going to shrink the cancer. What we don't know up front is by how much. In HER2 new positive breast cancers, particularly those that are 1.5 centimeters or larger, and a patient's highly motivated for breast conservation, I almost always recommend neoadjuvant chemotherapy because in the HER2 new breast cancers, the response to that upfront chemotherapy can be quite dramatic. In fact, there's a significant percentage of time that the cancer will actually pathologically disappear in the breast. Another advantage, if you will, of neoadjuvant chemotherapy is it tells us something about the biology of the cancer. If there's a really good response or a complete pathologic response, the patient may do better. Now, this is a debatable subject. There are those that say, gee, there's no difference in survival. But in those who have complete pathologic response, cancer disappears completely pathologically when you operate in the breast and remove the area where the cancer was and prove that it's gone. In that subcategory of patients, most of those patients, in fact, do better. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.